In this video, we'll look at how this platform can help the National Health Insurance Scheme to manage HIA providers, create new plans, beneficiaries, and then create dependent as well. How beneficiaries or enrollee can do check-in at the provider's facility, and then how the provider can raise a claim or maybe raise a claim, do referral, and then can request for authorization. Some basic information has been created, HIE facility and then provider. I have a plan already created, and I think I have just one single beneficiary or really created already. So I will be creating a new beneficiary, and then I'll be utilizing the HIE facility that has been created, the provider, and the plan. But I'll quickly log in with an administrative account so I can briefly run us through what has been created. So this is the login details for the admin. Click on login. There's a landing page. So from here, I have a provider. Okay, let me quickly run to the menu. So we have the home, which is the landing page. We have the beneficiaries, and that takes care of the enrollees. We have the premium payment. That is the premium that has been paid by the enrollee can be accessed from here. And then we have the organizations. So these are individual company organizations. These are individual company or organizations that are providing sponsorship for enrollee, maybe the less privileged, or and then we have the provider. This is where the enrollee is where they access care. And then we have the HIA, that is the Health Insurance Agency. So these are the ones that manage the the plan and the policy. And then we have the plan. This is where we create the plan. We have the check-in. So when the enrollee goes in, it goes to the provider. So this is where you authenticate the enrollee. And then we have claims. So this is where the provider raises the claim, and then the referral. This is when referral can be done, and the authorization. Okay, and then we have the claims payment. So this is where the HIA can do claims payment for fee for service, and then complaint. So this is where this has to do with support. Then we have the claims. We have the fund management, and then the analytics, the role, and then the user management. Okay, I've created few providers. So these are listed. These are just dummy data, and as well, I've created dummy data for HIE as well too. So I have HIE Lagos, I have HIE1, HIE2, like that. Okay, and I also create a plan. I have a plan already created that is from a sector. If I click on this, I can see okay, it has two categories, but also 25,000, and then for individual 12,000 per annum. Another thing that can be done is actually to add a list of services that are covered by the plan, and the one that requires authorization, the one that does not require authorization, that as well can be set up alongside with the plan. Okay, so let's look at how to create a beneficiary or an enrollee. So I already have a HIE account that can be used to create a beneficiary. Click on login. Beneficiary. I already have two beneficiaries listed in here. Click on add beneficiary. You add a new beneficiary. Okay, so gender male. Marital status, single. And if they're dependent, you can indicate the number in here. Okay, so let me make this married. And then having one dependent. Yes. Right, next. For the beneficiary, date of birth, relationship. I click on add. We can click on next. And then by default, the HI registering the enrollee is selected by default. Then from here you can select the provider. And this is a primary care provider. Plan, formal, my sector, and I can pick. There's also package, for example, organization. So click on next. So you can see there's a brief details about the enrollees. So from here we can proceed to make payments, pay premium. All right, so through cash. All right, payment successful. Personal detail. Then you can approve the policy. Once the policy is activated, the beneficiary can go ahead and enjoy the service. Okay. If I go to list of my beneficiary, I'll find Akinla Taiwo and Akinla Furike. And the type BP represents that Akinla Taiwo is the primary, and then the D indicates that Akinla Furike is the dependent. So when Akinla Taiwo need to access care, how does it go about that? To attend to Akinla Taiwo, by the provider, or what the provider needs to do is to log into the portal. And then from the list of beneficiaries, you can as well say that Akinla Taiwo is part of the release that is attached to user facility. Then from here, you can click on check-in to verify that this person is Akinla Taiwo. Okay. I click on generate OTP. A one-time password was sent to the phone number that was used to register. The primary phone number that was used to register. Okay. I have the OTP. Enter the OTP. Verify OTP. So this information with this OTP, the enrollee has already been checked in, and then from here the provider can select the encounter type, if it is inpatient or outpatient, and then the encounter date. Check it. Okay. So from here, if the provider needs to generate claim, all you need to do is to click on generate claim. If he has to raise a request for referral, you need to click on your referral, and then if there's a need for authorization, you can as well go ahead and click on authorization. And then when it's through with this documentation, you can as well check out the enrollee. So to create, to send a claim, click on generate claim. Then you can select visit type. And from here, and select the symptoms. Yes, so duration. So you can add, then you can add as many as possible. Diagnosis. Okay. Now what was done? Then was given. So that's one area. Um, so, select the okay, test name. Then even a procedure is performed, you can as well add that. And then there's additional documents. And from here you can put in a note, you can Just for the purpose of this video, then a doctor, so we can wait. And you can save this. So this information will be sent to the HIA as what was done for the patient. Let me log in as the HIA so that we see what the HIA was saying. So the HIA2 can as well log in and then go to claims and see the list of claims that has been generated. This can be open. We can read through, and this can be like okay. Alright. And then let's look at how to do referral. Okay, we'll go to checking and I'm gonna so let me do for terrible, okay? HTTP. Okay. Type in the OTP, verify OTP. For outpatient, checking. So let's look at new authorization. Or okay, let's go at authorization. The same sequence. The information is already filled in here, so select the class of visit. If it is an emergency, you can as well indicate that by checking this that it's an emergency. And then what is the complaint? Then you can add as many complaints as required. Then the clinical note. Let me just put not available for the purpose of this. Then you can select the diagnosis. Just pick malaria. Okay, let me just pick this. Then investigation. Okay. I actually select this to indicate that if authorization is required, the system will automatically notify that. That's why we have this check button activated. Then you can select drug. Then you can go to you can select the doctor. And then you can click on send. So the HMO will be able to see this and then they can do approval. At the same time, we can as well send a referral. So in my check-in, I already have tariff for the care. I can click on this to view and then I can create a referral request. Then I can okay. No, I think I only have just one hospital in here. Okay, so destination cannot be the same as the source. Oh, so I think I only have just one HIA that is set up in there that can, I mean, that is workable in here. But, okay. In the next video, I will capture that. Create a new HIA that is secondary or tertiary, and then I can capture referral from it from there. Okay, so for the authorization, the HIA can as well log in and then go to authorization, and from there you can see this. You can go ahead and approve this to be given, approve this to be given, and then you click on general approve. Then you can see that this is approved. And then from platform owner point of view, you can see transactions relating to a particular HIA. By going to HIA, I click on the details for this HIA. For instance, I can see the number of enrollees that are attached. I can see claims, pre-authorization that was signed, premium. We have two policy P003, and then two, and then the premium that was paid, the date, and then I can see for pre-authorization. You can see this for Terry, and then it has been approved. Then you can do that for claims as well too. And then for list of plan, that's the list of plan that is active for the HIA. And then here you have the HIA details.